Welcome to the deep dive. Today, we're tackling something really important. We're diving into the care protocol after a carotid endarterectomy.
That's right. And we're working directly from, well, the source itself, the actual post-procedure protocol document. This is the guidance you'd get.
Exactly. So our mission here is pretty straightforward. Cut through the medical jargon and pull out the absolute must-know information for you from this document.
Yeah, what you really need to expect, the key steps for recovery and, long-term health, all straight from this source.
Okay, let's jump in. Right after the procedure, the protocol emphasizes rest, right? Taking it easy.
Definitely. Avoiding strenuous activity is like the very first thing mentioned.
Got it. Take it easy. And hydration is also mentioned, isn't it? Staying well hydrated helps the overall recovery process.
Absolutely. Simple but important. Keep that water bottle handy.
Yeah.
So moving on to what's often a big concern, wound care. The protocol is very specific. Critically, you have to avoid getting the wound wet. So no showering over it, definitely no soaking. And you also want to minimize, pressure or tension there.
Right. And keeping it covered.
Yes, exactly.
Mm-hmm.
With an absorptive dressing, the guidance says replacing every 3 to 5 days. But, and this is really important,
Okay.
if that dressing gets saturated, like soaked through,
Yeah.
before that 3-day mark, you don't just swap it out. You replace it, and you need to contact the consulting rooms immediately. That's a clear signal something needs checking.
Wow. Okay. That detail about calling if it's saturated early, that's a really critical takeaway. Good to know. Let's talk medication. The protocol is very clear about sticking to the plan.
It notes that typically you'll be on an antiplatelet drug, like aspirin, often combined with clopidogrel.
Right. And what if you were already taking something else, like an anticoagulant?
Good question. If you are already on, say, Warfarin or Rivaroxaban, the protocol usually says you just continue that. And, of course, you keep taking all your other regular meds for blood pressure, diabetes, cholesterol, whatever you have. Sticking to the med schedule is, well, non-negotiable, according to this source.
Makes sense. Now, maybe the most vital part for peace of mind, knowing when you need to actually seek help. The protocol lists specific warning signs.
Yeah, this is where you really need to pay attention. It lists things like sudden onset of pain, swelling, maybe loss of sensation, weakness, or even like discoloration right at the wound site.
Okay.
But it also widens that out to any neurological symptoms or really any sudden change that feels concerning.
And just so you listening are clear, when it says neurological symptoms, what exactly should you be watching for?
Right, because knowing these is crucial. We're talking about things like sudden numbness or weakness, particularly if it's just on one side, face, arm, or leg, or sudden confusion, trouble speaking, maybe even understanding speech, or sudden difficulty seeing in one eye or both. Also, trouble walking, feeling dizzy, losing balance, or a sudden, really severe headache that just comes out of nowhere. Basically, the protocol says any of these need immediate attention.
That clarification is super helpful. And I like the line they include, sort of sums it up. When in doubt, phone the consulting rooms. Empowers you to trust your gut.
Exactly. Better safe than sorry, always. And speaking of checking in, there's a follow-up appointment mentioned too, right?
Yes, it specifies that, usually prearranged, typically within about 2 weeks after the procedure.
Okay, so that covers the immediate aftermath and the near future. But what's interesting is this document goes further. It talks about long-term stuff, specifically exercise.
Yeah, I saw that. It really highlights how important daily exercise is.
It even suggests types like walking, cycling, swimming. Explains it helps strengthen calf muscles, improve circulation, all vital after this kind of surgery. You can usually build back up to a full program around 4 weeks post-op.
And alongside exercise, weight control is specifically mentioned too, part of that long-term management.
Definitely. And crucially, smoking cessation. It's flagged as absolutely essential.
Right.
The protocol even mentions thinking about aids, like varenicline or bupropion, if you need help quitting. It's a whole-person view of recovery, extending way beyond just the surgery.
So, putting it all together for you, this protocol document really gives you a clear roadmap. It starts right after surgery and guides you towards building healthier habits for the long haul.
Understanding it, following the specific instructions, paying close attention to your body, and knowing exactly when to call for help, that's all fundamental based on this source.
Yeah, following this guidance really is key for getting the most out of the procedure and supporting your health long term.
Absolutely, cannot be overstated.
So here's a final thought to chew on. Thinking about how this protocol blends that immediate hands-on stuff, like the very specific wound care, with these big long-term lifestyle changes, the exercise, quitting smoking. What does that combination really tell us about the kind of ongoing commitment that health recovery actually involves? And maybe more pointedly, how can integrating those healthier habits right now as you recover truly set the stage for a better health, not just next month, but years down the line? Something for you to think about as you move forward using this guidance.